Patient to be laying flat, not over a pillow. If they've got a pillow under their neck and chest, it's going to put them into neck flexion, which is going to open up these interspinous spaces, and we don't want to do that. Okay. So when you guys look, here's occipital protuberance. Here's where we're bracketing. You guys might have to move. I'll show you. Here's where we're bracketing. You guys see how far away we are from?
Right. Yeah. Not what we.
So even though in our heads it's all right there, but it's a little bit far. We're still not going to needle like super anterior to posterior to anterior, right? But this is the occipital protuberance, and this is where we're bracketing. We're far away. We're far away. So let's take a look now at the cervical paraspinals. And usually what I do here, because we know, man, if I hit the paraspinals, we're going to do good for all of the paraspinals. So I don't have to go like segment by segment and stuff like that. If they're a cervicogenic headache, where in the paraspinals might we prefer to needle them? Upper cervical, right? Like C2, C3 area is a good idea. C1, C2, C2, C3. If they've got more like lower neck pain, levator scap pain and stuff like that, maybe C2, C3 is not where it's at. We'll come and needle lower. The good news is that if you'll take the time to explore, your fingers will tell you what the patient needs. The body's a map. If you take time to read it, right, it's going to tell you. So if I palpate along her paraspinals, we can get a couple of options. The whole side could be tight. Lower paraspinals might have a little knot down in here. Upper paraspinals might have a little knot up in here. If it's the whole thing, you can needle it once and expect it to do good for the whole thing. If you want to be more thorough, you can hit 2 or 3 spots. My first session with anybody, because nobody in here likes getting needled. None of y'all are that sick, right? We don't love it. Some people really do. But my first treatment with anybody, I want to do as little as possible. Okay? This protocol is quite a few sticks, but there's a reason why. We're going to cover everything, one session and be done, right? But so that's why I'm not going to say needle a bunch of places in here on your first day. Let's pick the worst spot in the paraspinals, needle that, and then check in on him next time. That's my recommendation, okay? And she already came and complained to me. She's like, I've had this knot, like upper cervical on the right for a long, long time. She's like, I know when it happened. She's like, I've had my neck manipulated a bunch of times and still just have this like soft tissue knot. To which I said, well, you know, sometimes you can have like a synovial cyst or like a collection of fatty tissue. Sometimes that can be there, but she feels like there was a mechanism of injury, like there was an event. So I don't mind needling it. So we're going to needle it. Okay. So we talked about what are our angles. So first of all, obviously we're going to go from posterior to anterior, right? And then we got 2 more directions that we need to add in. Lateral to medial, and then superior to inferior. So we've got the articular pillar as a backdrop, right? I would say it's probably about 45 and 45. Some people say 60 and 60. Doesn't matter. It's close enough. Trust me. Like, this is a big, safe area. Okay, so you guys can easily palpate right in the middle. There's spinous processes. If I just poke my finger in here, you guys can see that paraspinal bulk on this side, on that side, poking out. So now what I want to do is, all right, let's see, from the spinous process, I'm going to come over a little bit. Aha, I now have muscle under my fingers, and I can curl my fingers onto spinous process and articular pillar. If you guys want a rule, I would say you don't need to be more than 1 to 1.5 centimeters to the side of the neck, but there's no guesswork. Grab those paraspinals, squeeze them medially. I said what, 45 and 45? And it kind of, you can just needle in here the angle of the needle for the prick doesn't really matter. It's just when you grab it and you're going to advance it, that's when it matters, because it's just going to fall anyways, right? You put it in, the needle's just going to fall, and then you grab it, and that's when you have to control that angle. So let me demonstrate that. I can do both sides, so everyone gets to see. Now, this happened to Alpina a minute ago. Somebody hit a pretty exciting spot in her neck. She's like, oh, I feel that a lot. Question, do you think asymptomatic spots are going to feel worse or symptomatic spots are going to feel worse? You're going to feel more when there's an actual trigger point there, so that doesn't need to scare you away. That needs to make you think, we found something. You know what I mean? And definitely, when you're needling patients, you want to be cool, calm, and collected. You want to fake it till you make it. You don't want to be like, I don't know. I don't know. Maybe let's just stop. Like, that's like scary as a patient, right? So, sorry. Think about that. Yeah. All right. So once again, from the midline, I'm going to come over, and as soon as my fingers just roll off, that's where we want to be. Now I'm just going to bracket, like open it up a little bit. I'm gonna let it be at about 45 degrees here, and if you're good, you can squeeze it with your fingers. If it falls, doesn't matter, right? So we want 45 and 45. Okay.
I'm good. That was a lot. I'm good.
And this has got to be an exciting spot, because how long has it been there?
7 years.
What segment are you at? What
Like
segment are you at? C2,
C2, C3. So it's gonna. I'm really curious to see. Don't go anywhere.
Sorry.
I'm really curious to see how this looks like after a needling sesh or two, and maybe we need to get in and do some manual therapy and stuff like that. Clearly, I've neglected my poor employees. So all their
7 years.
Stay. Can I do this?
Okay.
I think this side will feel fine compared to the other side. So from the midline, curl the fingers, sharp angle towards the spine, 45 degrees down.
How did that compare to the other side?
She didn't jump.
She didn't jump, yeah.
So I didn't freak out like this is expected. You can have, that's what the Chinese call ashi. Like that was an ah shit moment, okay?
Now I know.
All right, so let's needle this one. You guys make sure that you are angled medially, quite sharply. If you guys want to err on the side of caution, let's make it 60 degrees. And then either 45 or 60, whatever you can do coming down. But you've got plenty of, where's my spine? You guys, look at that. Like there is quite a lot of backdrop there. So what we're doing is, you guys can see, okay? Right? From here, we're finding those paraspinals. Where's my marker? Hand me one of those markers. Okay. I'm coming to the end of the paraspinal bulk and I'm bracketing that. And even if I went straight anterior, I'm probably going to land up on transverse processes, right? But we're not. We're going to angle it. Here's the end of the paraspinals. As soon as you angle even a little bit medially, you're good. I think at 45 degrees, we're good. I think 60 degrees is overkill, but you can go 60. And then with the addition of the downward angle, like all day, you know what I mean? So what you got to do is don't push the paraspinal bulk anteriorly like that. You want to curl around it and then needle between your fingernails. You see that? You want to curl around it and then needle in the degrees and the angle we talked about between your fingernails. It's totally safe. It's totally safe. Let's do it.
You have a
Let's
history
go.
of whiplash? You have a history of whiplash?
No, not
I
that
bet you remember.
know of.